Hey everyone, Dr. Live02 here, and in this video I really want to talk about our Live02 multi-step oxygen therapy. We call it the Adaptive Contrast System. So the reason we use this quite a bit is just oxygen it's a major source of life and healing, and we need it to regenerate. I mean, obviously, right? Oxygen's a huge deal. In the previous videos, we were talking about, what we're doing for patients with COVID and helping them to rehabilitate maybe the sense of smell and their taste, or even some of the dementia-like symptoms. But this video, I just really wanted to talk about what this thing's about and why we use it, how we use it, who we use it on, what kind of results we've been getting. So this is kind of interesting. It's very similar to exercise with oxygen therapy, HBOT as they call it. I mean, it looks like it. We use the same type of things where someone's going to exercise while we're pumping in oxygen. But the difference with this system, we go from a positive oxygen to a negative oxygen. So I'm pretty sure with regular exercise with oxygen therapy is just a straight oxygen concentration. You just do it while you're exercising. It's trying to pump it through your body, which is very helpful. But a lot of times it won't create the same type of effects in the microcirculation and oxygenation to the deepest part of your tissues like hyperbarics would. So some people even say they've had better results with this than hyperbarics, and it's a fraction of the price and a fraction of the time, and we're not sitting in a big tube or anything like that. So if we have claustrophobia or anything like that, that's one of the benefits up here as well. So this particular system, what happens is, we're breathing like 19% oxygen outside, right? So if we're lucky, I guess. But what's happening is when we put you on this machine, we're going to start pumping you at 100% oxygen. So just very similar to the exercise with oxygen therapy. The difference is that halfway through, we're going to start going to negative oxygen, meaning like 14%. When you're exercising at 14% oxygen, it really feels like you're walking or running uphill at 10,000 feet. You're going to be huffing and puffing. But the whole point of that is it's creating like this starvation effect in the body, and then the brain it kind of goes into a stress mode, and what it does is it starts uptaking or taking in more oxygen. Okay? So if we have less oxygen, it wants to take in more, so it'll do everything it can to absorb every little bit of that oxygen, as opposed to if it had an abundance of oxygen, it's not going to really, work harder to bring more oxygen in. So what happens is when you get that starvation mode and the body's huffing and puffing and getting tired, we'll flip it right back to that 100%, and what that does is the body will just suck that 100% oxygen back in. So it's super healing, it's super energizing. It's amazing for head injuries, amazing for old concussions, things like that. It's been very helpful with people with cognitive decline, dementia-like symptoms, Parkinson's, Alzheimer's. I'm not saying that it's proven to work for those things, but getting oxygen to those tissues really help with increasing brain function. We've seen really good results with people with things like COPD or chronic lung problems, or like I mentioned earlier, we were working with a couple people that kind of have those post-COVID symptoms still, where they have shortness of breath, and we're using it to help those lungs heal as well, okay, get breathing back. We've also been using it quite a bit with even our autoimmune patients. So again, it's a big energy producer for the body, and so if someone's low on energy, fatigue, chronic fatigue, this is another big thing that can really help someone get their energy back up. What the research says about this particular machine is that over time, our blood vessels, as we age, it's an age-related thing, they say, and I'll show you the book that all the research is behind this, behind multi-step oxygen therapy. But what happens is your blood vessels that are nice and open, we can get some nice blood flow and red blood cells and nutrients there. What happens over time, there's a switch. So sometimes the blood vessel will want to constrict, sometimes it'll want to open up, and through various factors. But what happens is, as we age, sometimes that switch will just shut off. That's how they explain it. And the blood vessel will go into more of like a permanent swelling, okay, which is going to constrict blood flow, especially at those deepest parts of our body where microcirculation needs to go through, to our tissues, to areas that really need to heal, which microcirculation improving that is a big deal for a lot of healing. So what happens when it swells is the red blood cells can't even fit through there. It's like only plasma is getting through there, and we're not getting the necessary nutrients and oxygenation that a red blood cell would provide. This machine has been proven to reverse that switch. and reverse its ability to function basically back to when you're like in your 20s and 30s, so the circulation of a 20 to 30-year-old, you know? And they say also, you know, permanently fixes it with, you know, they say with continued use. So I thought that was pretty cool. Yes, if you do it as for maintenance, but I just thought it was very neat that it could reverse that issue that happens as we age that prevents proper circulation and oxygenation of our tissues, which always leads to things like fatigue and shutdown of our organs and things like that. Just things that are related to degeneration as we age. So here's the book I was talking about, Multi-Step Oxygen Therapy. This is where all the research is that proves what this thing does. And like, be careful though with that book. It's super dense, you know, a lot of fun terms and everything like that. But the research is there, and I think that's pretty amazing to show it with a technology like this. Like I said, a lot of people have even said they've gotten even better results on something like this than with hyperbarics, which I'm not trying to say, okay, you know, but this just happened to work out for us. Again, for the patient, it's a fraction of the cost compared to hyperbarics. It's a fraction of the time. So we're spending 15 minutes per session on these as opposed to maybe 45 minutes to an hour in a hyperbaric chamber. So it's just another great tool that we have that we've been using. And again, for so many different things, you need oxygen for life itself. So when we're trying to heal major chronic illnesses or issues, cardiac function, hearts, lungs, things like that, it even helps to lower inflammation. So brain function. I mean, these are all the things I'm trying to get you to think about. Like, why would we use oxygen therapy, and who's it good for? A lot of major athletes use it for recovery, for strength, for endurance. But you know, in our office, you know, we typically see things like autoimmune and brain or nerve-related injuries, and that's who the people I tend to work with. So I don't see a lot of major athletes, but again, it's something that is helpful for that. So I hope you guys enjoyed watching this. I hope it maybe shed a little extra light, like what the heck this thing is and what it does and why is it so noisy in your office all the time. I'm just kidding, but it is kind of noisy. But I hope you guys enjoyed the video and have a great rest of your day. You guys take care.